C3 Collaborating for Health has been around for 10 years, focusing on those risk factors which cause chronic disease and lead to a lot of ill health, disability and premature death. As I think many nurses know, those risk factors are smoking, eating and drinking too much and not well enough, and not having enough physical activity. The world is now faced with this horrendous pandemic of coronavirus, and nurses everywhere are at the forefront of trying to treat sick people and prevent the spread to themselves, their families, and their patients. It's important that nurses look after themselves and that we recognise the underlying risk factors for chronic disease are exactly the same as are making coronavirus worse for so many people. Smoking is a risk. Obesity is a risk. So it's important that nurses look after themselves and that we all recognise the underlying risks to our health and well-being. Good luck and take care, all of you.
Hi there, my name's Tom Sanford. I'm the mental health nurse here at C3. Over the past year, we've become increasingly concerned at C3 about the mental well-being of the nursing workforce in the UK. We've been looking at the sickness data for nurses, we've been looking at the stresses that nurses have been working under. And that's led us to launch a series of initiatives specifically to support nurses in relation to their mental health in the workplace. And little did we know at the time that coronavirus or COVID-19 was going to come along. And those initiatives that we've been developing have even greater importance now that you're all working in such difficult circumstances as clinical nurses. One of the things that we've provided on our website, on the C3 website, is a webinar for nurses around their own mental health. In the webinar, a series of experts look at some of the issues that relate to nurses doing their everyday work and the stressors of doing that work, and help with some solutions in terms of how nurses can manage that. We very much hope that you'll go to the C3 website and that you'll look at that webinar. We wish you well in the work that you're doing. These are difficult times for us all and very, very difficult times for our patients. We really hope that you will safely come through.
Hello, my name's Michaela Nuttall and I'm a nurse. I work here at C3 and have done for about 4 years looking at the health of nurses, in particular when I first started here looking at the Healthy Weight Initiative for Nurses, where I spent many years engaging with nurses from across the country, exploring about nurses' own weight and why they felt obesity was an issue for them. Now, the work that came out of what we were doing, I think, has never been more pertinent than what it is today. So 4 years ago, nurses were telling us those 12-hour shifts were a real challenge to try and maintain a healthy lifestyle. And within those 12-hour shifts, access to water, food, breaks, rest time, de-stress time, all of those things were really challenging to have within the 12-hour shifts. Alongside that was also just the sheer experience of working as a nurse. And the challenges that made it more difficult, as well as caring for family, friends, loved ones, parents, children. All of these things really contributed towards their own ability to maintain and achieve a healthy weight, and with that comes all of the stuff that's with lifestyle. Never before have we been working under such conditions as what we are now with the coronavirus and COVID-19. And I think this is really amplifying the challenges that it is for nurses to be able to maintain a healthy lifestyle, so physical activity, eating lots and lots of fresh fruit and veg and eating a very sensible diet, along with not smoking and moderate alcohol. All the things that we know and we try and get our patients to do to maintain a healthier lifestyle is going to be more difficult for nurses to do now. So I was, I don't know if to say fortunate or unfortunate enough to be able to observe to sit and observe and see what it was like for nurses on the front line. So my daughter's currently in hospital with COVID-19 at the moment, and I got to sit there and just see how hard these frontline staff are working, the stresses that they're working under, even watching them trying to work out toilet breaks and how are people going to organise that with with all the full PPE gear that's on. So really challenging times, I think, for nurses to be able to work under. I certainly know, talking to our local practice nurse, that again, trying to provide the level of care that they're trying to, and again, the nurses who work out in the community and nurses all over will be struggling to deliver the job that they know is what they want to be able to do, and somehow balance that with a healthy lifestyle. So my call for nurses is to be able to say, don't stop looking after patients, because that's what we do, that's what you do. But please try and remember to keep looking after yourself at the same time as well. Take care, and thank you.